Hello, everyone, and I'm Aaron Wallace from Engaging Arkansas Communities, and today I'm joined by Russell from Diversity Family Health.
Hi there.
Hey, Russell, how are you?
I'm doing well. I'm doing well.
Tell me about your organization.
So, Diversity Family Health is a primary care medical practice that focuses on providing care in an environment free of discrimination and bias, most commonly focused on the LGBTQ community. So, we do everything from general primary care like hypertension, diabetes, those kind of things, to, of course, HIV prevention and treatment, gender affirming hormone therapies, women's health, all those things that affect the LGBTQ community more than others.
And where are you located?
So we have 5 locations in the state of Oklahoma, but in Arkansas we have 2 locations, one in Little Rock, Arkansas in the doctor's building on South University, and then a pop-up clinic in Arkansas that we're there about a couple days a month.
Are you looking to expand more in Arkansas?
No, absolutely. As there's obviously a need here for services for the LGBTQ community, and so as we go into a community and start these pop-up clinics like we have in Hot Springs, and then build those from 2 days a month to 3 days a month to 5 days a week. And then we go into other communities as we have nurse practitioners or other healthcare providers that want to open a clinic. Then we go and help them do that.
Okay. Do you also do like telehealth services?
We do. We have a lot of telehealth services that we do most specifically for the rural communities that can't necessarily come in to the metropolitan areas.
And how do people find out about these resources or can book an appointment or
Yeah,
just get in touch with you?
Yeah, so our website is diversityfamilyhealth.com, and so that's one of our primary things. Word of mouth is a big one. I believe if you tell one gay person, they'll tell the rest of the gay people.
We do like to chatter.
Yeah, so we provide, we just provide a level of care that we believe, people like to talk about. And so, word of mouth is one of the primary ways, as well as our website. You can find us on Prep Locator. You can find us on, HIV treatment websites and those kind of things as well.
Now, do you offer, I know a lot of clinics that do the wine white program or insurance,
Yeah.
what does that look like
So
at your organization?
we do it all. So we have commercial insurance. We take commercial insurance as well as we take Medicare and Medicaid. We are a Ryan White provider, so we can also provide Ryan White. And so for Ryan White, we take care of not only just their HIV care, but also their other primary care needs. And then we also have some programs specifically for PrEP and for HIV, where we can get them we can help pay for their premiums for a Blue Cross Blue Shield plan when they're on PrEP and HIV services through our 340B program. And then, of course, we have a sliding scale program based on income where we have a low scale office visit of $80 plus the cost of any testing. So we try to do everything we can to make sure that people have access to care regardless of how they need to pay for it.
Well, that's awesome. And I hope you get to expand more into Arkansas because
Yeah.
that would be really wonderful to
Yeah.
have more services like that because this seems like it's also creating a safe place for someone to come to get the services they need. Because sometimes I've been to the doctor before and I had asked about PrEP and he had no idea what I was talking about.
Right.
And I was like, oh, well, then I didn't know where to go from there. It got really threw me off.
Right.
So.
And that's just our main goal, is having this space that's free of discrimination and bias, because we see all people. We have a lot of heterosexual and a lot of cisgender individuals that come see us because we take care of everybody, but they can also get safe care other places, or there are other providers that can provide them care. So that's why we focus on the LGBTQ community, because we want to create that safe space. And all of the people we refer out to, let's say you come in and you need to see a neurologist. Well, we're going to vet that neurologist first to make sure that their staff has had training in how to care for our culture. And many people say, oh yeah, we take care of anybody. It's like, right, but have you had training on our culture so that way you can better take care of them and that we know that this is a safe space? And if you don't have that training, we'll come and provide it for you. One of the biggest things we do is outreach to other primary care physicians, because my hope would be in the future you'd be able to go into any doctor and they would understand what PrEP is and be able to say, yeah, I know a little bit about it. Let me figure it out. You're my first patient, but I'll figure it out, as opposed to being like, oh, no, I don't do that. Or you should abstain from sex, or that's the wrong kind of sex you're having, or, whatever they want to push off on you.
Well,
shame you for it.
When I asked my doctor about it, I was like, my doctor doesn't know about this medication. Is there anything else he does? It kind of made my mind start wondering.
Right, absolutely. Yeah,
but it's also a great organization like yours helps with stigma, too, because
Yes.
I know not everyone we're not at the place where every clinic is very open in that.
Right. Well, and the thing is we're focused on the LGBTQ community, but we're not the only one with sexual health needs. That there are plenty of cisgendered people that have some of the same sexual practices, and heterosexual people that have the same sexual practices that we do, but it's not talked about in many doctors' offices. So that's another goal, is to get it to where they're talking about what sexual practices all of their patients have, not just the ones that they perceive are gay or not. And I always tell patients, your sexual orientation is between you and your therapist. I just want to know what body parts are touching what body parts, so I know how to keep you safe.
Help and keep
right. So all people have sexual health needs that need to be addressed.
Awesome. Well, thank you so much. What's that website again where people can find out about
It's
you?
www.diversityfamilyhealth.com.
All right. Well, thank you again, Russell, for chatting with me. I appreciate it.
Absolutely. Thank you.